I am so delighted to be presenting the findings of this survey. We're going to be covering drugs first and then followed by our alcohol findings. Throughout the presentation, I'll be highlighting significant differences across demographic groups and across regions. These are going to be shown in yellow boxes on your screen. I'll also be comparing this year's findings with previous waves of research. But I think it's important to note with this that respondent numbers do vary year on year across the survey period. So in 2025, the data represents 10,561 respondents studying in higher education in the UK. The majority, 78%, are undergraduates and 36% are aged between 19 and 20 years old. I'm going to begin with our findings on drugs. So this slide shows our findings of respondents' perception of student drug use. So we asked respondents what percentage of university students they think use drugs, both before they started university, which is the blue bar, and after starting university, which is the pink bar. Before starting university, we can see that 92% of respondents thought that students use drugs at any frequency. This is the sum of the blue bars on your screen from 1 to 10% downwards. After starting university, 86% believe that students use drugs at any frequency, which is some of the pink bars. Additionally, we can see that a higher proportion believe that more than half of students, which is 51 to 60% and above, use drugs after starting university in comparison to a lower proportion before starting university. So for example, 6% before starting university believe that 61 to 70% of students use drugs, compared with 8% after starting university. So we, as part of the survey, showed respondents statements about university culture and about student drug use and asked them to what extent they may agree or disagree with these. So the first statement, students take drugs to fit in with their peers, we found that 44% of respondents agreed with this, while just a quarter, 25%, disagreed. We also found that women respondents are more likely to agree than men respondents, and that those with a home fee status are more likely to agree than those with an overseas fee status. Moving to the statement below this, there is a problematic drug culture at my university. We found that 16% agreed with this statement, while nearly half, 46%, disagreed. We found that respondents who identify as mixed and or multiple ethnicities are more likely to agree with this than those who identify as Asian ethnicities, and that disabled respondents are more likely to agree than non-disabled respondents. So this slide shows our findings on frequency of student drug use. The majority of our respondents, 78%, said they do not currently use drugs, while about 1 in 5, 19%, said they currently do. A quarter, 25%, have used drugs whilst being at university. This slide shows our trends over time in both perceptions of drug use in university culture, which is the blue line on your screen, compared with current drug use, which is the pink line. You can see that there are asterisks, that sounds like a mouthful, next to the percentages, and this just indicates statistically significant difference to the previous year of research. So we can see that the proportion of respondents who agree that taking drugs as part of university culture has generally declined over the 5-year period, falling from 27% in 2021 to 20% in 2025. Current drug use does follow a slightly different pattern. So after significantly decreasing to 10% in 2022, it's then significantly increased to 21% in 2023, before declining to 19% in the latest wave of research. Reasons for student drug use. So we found that the most common were for recreation or for fun, 71%, to enhance my social interactions, 21%, and 18% just for something to do or boredom. The least common was because friends, family, or people I was with pressured or encouraged me to cope with a difficult life event, or to self-medicate an existing physical health problem, all 6%. In terms of who reported what, in terms of different demographics, we found that respondents who are aged 19 to 20 were more likely to report that they use drugs for recreation or for fun, compared to 20 21 to 25-year-olds, 26 to 30-year-olds, and 31 to 35-year-olds. We also found that non-binary respondents are more likely to report that they use drugs to self-medicate for an existing mental health problem than both men and women respondents. We also found that disabled respondents are more likely to report this than non-disabled respondents. Lastly, we also found that respondents who identify as Black ethnicities are more likely to report that they use drugs to self-medicate for an existing physical health problem than respondents from white and mixed and/or multiple ethnicities. As part of the survey, we ask about students about their frequency of particular drug use. So this slide shows our findings for cannabis. So we found that around 7 in 10, 69% of respondents who are currently using drugs are using cannabis, with 12% doing so daily or almost daily. Polydrug use. So in case you're not familiar with this term, this just refers to doing 2 or more drugs at one time, either at the same time or in close succession with one another. As part of the survey, we did ask respondents to include alcohol as part of their answer to this. So while 44% of our respondents said they never do 2 or more drugs at one time, 22% said they did so occasionally, with 3% reporting that they do 2 or more drugs every time they use drugs. So this slide shows our findings of how our respondents tend to procure drugs. The most common way of doing so was receiving without payment from friends and or family, with 39% reporting this. This was followed by being purchased in person from a regular dealer or regular dealers, 32%, and then being purchased from friends and or family, 30%. The yellow boxes to the right of the screen look at demographic differences in terms of habits of purchasing drugs online. So specifically, we found that 4% of our respondents said they purchased drugs online via the conventional web. We found that men were more likely to report this than women, and that disabled respondents were more likely to report this than non-disabled respondents. We also found that 3% said they purchased drugs online via the dark web. We found that respondents in London are more likely to report this than those in the east of England, and that those aged 56 to 60 are more likely to report this than those aged 17 to 18 and 19 to 20. Lastly, 6% said they purchased drugs online via social media. Men were more likely to report this than women, and those aged 21 to 25 more likely to report this than 19 to 20-year-olds. So we ask respondents about the impacts they may have faced during or following drug use, which can be roughly sorted into about 5 categories. This slide presents the top 2 most commonly reported impacts of each category. So beginning with academic impacts, we found that 21% of respondents said they missed a university seminar, lecture, or class, while 14% reported arriving late during or following drug use. Moving to impacts related to antisocial behaviour, 7% said they got into an argument with people they know, while 5% got into an argument with strangers. For well-being, 15% said it improved their day-to-day experience of an existing mental health condition, whereas 12% said it made an existing mental health condition worse. For relationships, 45% said they made new friends, while 41% said they became closer to existing friends or family during or following the use of drugs. Lastly, behavioural and safety impacts. 19% said they enjoyed the experience of having sex on drugs, while 17% reported being able to remember what happened the night before. This slide shows our findings on university advice and information and support on drugs, both respondents' awareness of, which is the chart on the left, and their use of services, which is the chart on the right. So beginning on the left, we can see that a quarter of our respondents, 25%, said they don't know anything about the advice and support available, whereas 20%, going to the bottom bar, said they know all of the advice and support available. We also saw on the chart on the right that 7% said they're using student union-run services for advice, support, and information on drugs, whereas 6% reported using university-run services. This is our awareness, our findings on awareness of university drugs policy. So the chart on the left looks at our awareness findings for 2025. 7% of respondents said they know their university has a drugs policy and know all of or a lot of what it says. Whereas skipping to the bottom, we can see that 30% said I don't know if my university has a drugs policy entirely. The chart on the right of your screen shows changes in this data over time. Again, statistically significant differences to the previous year of research are indicated by an asterisk next to the percentage. So I don't know if my university has a drugs policy is represented by the blue line, whereas I know my university has a drugs policy and I know all of or a lot of what it says is the pink line. So the proportion of respondents who said they don't know whether their university has a drugs policy has generally declined across the survey period, from a peak of 44% in 2022 to 30% in 2025. At the same time, looking at the pink line now, awareness and understanding of university drugs policies increased. So for example, in the latest wave of research, 7% said that they know their university has a drugs policy and they know all, or they know a lot of what it says, which is the highest percentage recorded across the survey period. Oh, skip the slide. There we go. So this slide shows students' views on how they believe their university should approach drugs policy. So we showed them various statements and again asked them to what extent they agree or disagree with this. The statement that attracted the highest level of agreement was my university should provide support to students who take drugs, with 3 and 4, 77% of respondents agreeing with this, whereas only 6% disagreed. On the flip side, the statement that attracted the highest level of disagreement was I would feel confident in disclosing information about my drug use to my university without fear of punishment, with 28% of respondents disagreeing with that. But obviously still 30% did agree that they would feel confident. I'm now going to move on to talk about our alcohol findings from this survey year, beginning with respondents' perceptions of how much students drank. Again, both their perceptions prior to starting university, which is the blue bar, and since being at university, which is the pink bar. So just focusing on the bottom of that chart, we can see that 13% of respondents reported believing that students got drunk all of the time before starting university. Since being at university, this decreases with just 10% believing this. So this slide looks at our findings on students' views on alcohol and university culture. So beginning with the chart on the left, we can see that 78% of respondents agreed that drinking and getting drunk is part of university culture. Moving to the chart on the right, this shows how our findings on this statement have fluctuated over time. So across all survey waves, a large majority of respondents have agreed that drinking and getting drunk is part of university culture. This figure has remained relatively stable overall, ranging between 74% and 81% across the period. Moving back to the chart on the left and going to that bottom bar, we can see that 72% of students or respondents disagreed that my university friends expect me to drink regularly and get drunk, with just under a quarter, 24%, agreeing with this. This is our findings on frequency of student alcohol consumption. So our quarter, or just over a quarter of our respondents, 27%, do not currently drink alcohol, while 3/4, 73%, currently do, with 2% reporting that they do so every or most days. We found that women respondents were more likely to report this than men respondents, and those in the east of England were less likely to report this than in the south and in the north of England. 13% of respondents said they've never drunk alcohol, and we found that respondents who identify as Asian ethnicities are more likely to report this than white, black, and mixed or multiple ethnicities, while non-disabled respondents are also more likely to report this than disabled respondents. Our reasons for student alcohol consumption are very similar of our drugs findings. So we found that 78% said they drank alcohol for recreation or for fun, 50% to enhance my social interactions, and a quarter, 25%, to improve my confidence. The least commonly reported was to self-medicate for an existing physical health problem, with just 1% reporting this. This slide looks at two kind of drinking behaviours that we sometimes see in student populations. So drinking alcohol in a house before going out for the night, and deliberately not eating so that when you go out, you can get more drunk. 41% of respondents said that drinking alcohol in their house or their friend's house before they go out for the night was something they do regularly. The chart on the right shows trends in this behaviour since the survey began in 2021. And this has fluctuated considerably since the research began, as you can see. The largest significant decrease happened between 2021 and 2022, from 61% of respondents reporting this to 38%. In the latest wave of research, we saw a 3% significant decrease from 44% to 41%. Going back to the chart on the right, we can see that just over half, 52%, said that deliberately not eating so they can get more drunk is something they would not even consider. So this slide is our students' views on drinking behaviours. So the majority of respondents, 78%, said they don't need to get drunk to have a good night out, while almost conversely, over half, 56%, said getting drunk means I'll have a good night out. We also found that 36% agreed that it can be difficult not to drink too much on a night out, or just over a quarter, 27%, said I sometimes feel pressure from my friends to drink more alcohol than I would like to. This is a new question we added for the 2025 research, which asked about students' experiences or witnessing of initiations and hazing or other welcoming activities or traditions involving alcohol. So we found that over half, 54%, said they have not witnessed or experienced any of these, whereas a quarter, 24%, said whether they witnessed or experienced these, they felt safe, supportive, and enjoyable, while 14% said they felt unsafe, pressured, or harmful. As with our drugs findings, we asked respondents impacts they may have faced during and following alcohol consumption. Again, we have the 5 categories, and this slide again is showing the 2 most commonly reported impacts for each category. So beginning with academic impacts, we can see that 39% said they missed a university seminar, lecture or class, while 27% reported arriving late during or following alcohol consumption. In terms of antisocial behaviour, 16% reported that they got into an argument with people they know, while 13% said they got into an argument with strangers. For well-being, 11% said it alcohol consumption made an existing mental health condition worse, whereas 7% said it improved their day-to-day experience of an existing mental health condition. For relationships, 64% reported making new friends, whereas 40% said they became closer to existing friends or family during or following alcohol consumption. For behavioural and safety impacts, 44% said they were unable to remember what happened the night before, whereas just less than a quarter, 24%, said they experienced unwanted sexual attention from a stranger or someone they know during or following alcohol consumption. This shows trends in respondents who report missing a university seminar, lecture or class during or following alcohol consumption in the survey period. So while both 2023 and 2024 represented significant increases in comparison to the previous year of research, the latest wave of research represented a significant decrease of 5% from 44% to 39%. The last slide from me. So this looks at students' awareness of both university alcohol-related campaigns and alcohol-free social events that happen at university. So beginning on the left, we found that 35% of our respondents said they were aware of communications related to staying safe while drinking alcohol, and communications related to drinking alcohol responsibly. 11% said they were aware of training for students related to alcohol consumption. Moving to the right, we also asked respondents whether they felt there were enough social events at university that don't involve having to drink or to get drunk. 61% said yes, they believe there are enough social events, while 1 in 5, 21% disagreed with this. That's all from me. Thank you so much for listening to the findings. Like Fiona said, I'd really encourage you to go and check out the report to read more of our findings. But for now, I'll hand you over to the other lovely Fiona, who's going to talk about next steps.
Great. Thank you so much, Molly, for going through all of that. And yeah, I have the really lovely job of spending some time thinking about what this actually looks like in practice and how we use data like this. And like Fiona mentioned at the beginning, data like this is really valuable in the field of drug and alcohol use, but particularly because data, when it comes to student current kind of use and perceptions and behaviours, is actually quite rare and can be quite challenging to collect. So we're really happy that we get to do that, and we get to kind of come and make it publicly available so that it can be used and be helpful for people across the sector. So before I get into some kind of specifics, I suppose, about how you might choose to use data, like the data we've provided, there's a couple of next steps that we'd like to encourage you to think about. So the first one is we have already launched our sign up to take part in the Students' Alcohol and Drug Survey 2026, which will take place in November and December of this year. And we'll be sharing a QR code, and I can put it in the chat box later. What will happen is when you do that, when you kind of sign up for that, when it gets a little bit closer to the event or when the survey is going to be live, we will give you resources in order to promote that to either your students or students in your local kind of region or area, to make sure that we keep having a really robust data set. We have been really thrilled the past few years, as you'll have seen in kind of the tracking, the number of students completing this survey and the amount of data we've had has massively increased. And what that means is that we are more able to draw kind of really robust conclusions from that data, whereas previously or on a smaller scale, we might not have been able to do that. So that is really great. So yeah, we'd really invite you to sign up to that, and then we will get back in touch with you when it gets a little bit closer to the time and discuss how you might choose to promote the survey. And as Molly mentioned, we really recommend that you read the full survey report. And we'll send a link round in kind of the follow-up from this, but we can also put it in the chat box as well. And what might be something that might be really helpful is, as you go through that, start thinking about, are there any particular areas that you'd like to know more about in your local area? So although kind of some of you might have taken part in the survey and got some local data that's relevant to your institution, there might be those of you who don't have that and are looking very much at the national picture, but that doesn't mean that you can't get that data. And so if there are particular trends that you're kind of seeing and maybe thinking, oh, I wonder if that aligns with what's happening a little bit more locally, I'll kind of talk in the next slide about how you might look to kind of collate some of that data and kind of use this as a bit of a springboard to kind of think about how you might collate that in a more local basis. Another really good action that you could take from this is find out who your local young people's drug and alcohol services and reach out to them. You'll have seen on the slides there was a lot, we asked students a lot about kind of their feelings and their opinions around accessing support. And there's a massive feeling from students that they want support that feels appropriate to them, and they want support that's specifically for students and young people. Some students do access that from their institution or from their students' union, but there will also be students that prefer to access that externally. And so one of the one of the most important actions you could do, I suppose, in order to reduce harm and kind of move towards that more healthy and inclusive culture is make sure that you're aware of how to signpost students to the right place. And also kind of how to signpost them to kind of local young people services where maybe that support that's offered feels more relevant or kind of feels more personal to them. It's also really helpful to be able to build connections. So if you've noticed something in this survey that you think, actually, I want to do a little bit more digging in this, you can also kind of build those relationships with your local service and ask them what they're seeing. And that also is a really valuable way to kind of build insight and build data. And it's also really helpful to talk to kind of colleagues, either in your institution or those of you who are sitting within drug and alcohol services, public health teams, NHS, schools, colleges. Talk to your colleagues, talk to local teams, to think about what data already might exist. And this is a really amazing data set. But it's a really, and like I said, we really encourage you to use this as kind of a springboard. But if there is data that you can also access locally that speaks more to kind of your local students, that can be a really interesting exercise to say, okay, well, this is what the national picture looks like. What do we look like locally, and where are those similarities and differences? And that can be really helpful at pinpointing where you want to do next and which areas you want to focus on. So just thinking about that and thinking about what data might already exist around you that you can use to kind of do that comparison piece, if that's something that would feel helpful, or to get more local insights. So for those of you who sit within higher educational spaces or further education or colleges or any kind of education spaces really, there may be incident reports that exist. So for higher education, those of you that have kind of residences on campus, because we know that students who are using substances, be that kind of alcohol or other substances, we know that they're likely to be doing that in kind of their own homes or in their friends' homes, in residences. And it might be likely that actually some of those behaviours that we're seeing and some of those impacts translate into incident reports that we tend to see in residences. And this can be really, really interesting when it comes to pinpointing particular times of year where incidents might be more likely. And they could also speak to maybe a trend when it comes to particular substances that students are using, for example, or kind of incidences related to pre-drinking and things like that. For those of you who, those students' unions who have venues on campus, you could also look at your sales of alcoholic and non-alcoholic drinks. And those of you kind of who work within the nighttime economy could do similar. So we know in our data, what it's telling us and what we're seeing is that there's actually a massive appetite for moderate drinking amongst young people and students particularly. And it can be really interesting to see if that's the case. And if that's not the case, is there anything that you could do, any kind of promotion or any kind of communications that might support students to understand some of the benefits of moderation, if that's what they choose to do? And then also thinking about how you might build in collecting some of this data into wellbeing surveys or events, or at point of access for student support services. So, for example, I come from a background of higher education. I previously worked in student support services, and actually asking about drug and alcohol use wasn't something that I routinely did as part of that job. And actually a really good way to build a really consistent understanding of student drug and alcohol use is to ask students and ask them when they're accessing support. And again, that can be a really helpful way of gathering data on things like the substances that students are using, but also the impacts of some of those substances as well. And then for those of you who work in kind of the local authority or kind of local communities, there's also a lot of data that you'll have access to. So things like young people's drug and alcohol service data trends and how many students they're seeing. Again, it kind of varies based on locality. Some drug and alcohol services will ask students if they are a student when they kind of access the service. Some won't, but you might be able to access some of that data. And public health data as well is really, really valuable. And strategies as well, kind of showing those local priorities. So kind of understanding where there can be that alignment between what's happening on campus and what's happening in the local community, and where you can do things like work towards shared goals, for example. And then, like I mentioned before, kind of incidents in the local nighttime economy or in privately owned accommodation related to drugs and alcohol. And you can collect that in a really similar way as we talked about with incident reports from residences. Kind of it can give you a real insight into some of the impacts of drug and alcohol use, but also kind of give some idea of those trends and pinpoint some of those times of year where it might be more beneficial to kind of target particular interventions or communications. And that's another thing that I kind of wanted to mention at this point is, I guess, the purpose of collecting all of this data, and I'll talk about it in kind of a couple of slides, but is really to kind of use it where you can to kind of drive your work in this area and make sure that the work that is being done and the work that you do is really rooted in what students need. And that's why we collect this data. It's really valuable for us to understand how we can make sure the work that we do is based on kind of recent student need and use, and make it as valuable as possible. So in terms of what that actually looks like, so I mentioned before around kind of using the data to help support you understand which areas of work to focus on. So we just included a couple of different points here around how you might go about that. So I guess one of the first steps and why we chose to do this is we identified that there was a massive gap when it came to data around student drug and alcohol use. Fiona kind of spoke to this at the beginning, but there's quite a lot of data that's collected at a government level or in an academic space, but actually data that sits across students and young people is quite scarce. And so we identified that gaps, and that's why we chose to engage in this data. And you can do something similar either on your campus or in your kind of organization. If you feel as though when you're going through the report, there's something that isn't kind of being spoken to, one thing to say is kind of let us know if you feel like there's something that is missing. But if you feel like that and you think, well, actually, there's something that we've heard from students and we don't quite get enough about this from the data report, you can think about then collecting or finding other relevant data. And we spoke on the slide before about where you might collect that from and what that might look like. But yeah, that's the first steps, is identify what you need, identify where those data gaps are, and then think about, okay, well, how do we collect this, or how do we access it if there is the data out there, for example, through the report. And once you kind of get that data, and I should mention, so for those of you who are in higher education and choose to promote the survey, if you get 100 or more responses, we give you your data, your kind of anonymized data, so that you are able to do a further analysis on that in a similar way to which kind of Molly has really amazingly analysed the national data. You can very much do that at the local level as well, and we'd really encourage you to do that, particularly kind of thinking about those student demographics. I think it can be really helpful at understanding what work you want to focus on. Once you've kind of found that data, you've collected it, you've analysed it, then you can start thinking about, okay, well, how do we operationalize this? How do we make sure that we're able to put things in place to support students based on what we know about their drug and alcohol use? And this is what we call kind of a design intervention. And that doesn't have to be kind of a big event. It could be communications. So to give you an example, one of those things that was picked out, I suppose, was around polydrug use. So we know that there are particular harms associated with polydrug use, particularly between certain substances. So if your particular local data, if you were able to have any, or if you looked in more depth at the national data, if you were noticing that there were certain combinations, so for example, cocaine and alcohol, which can be particularly harmful, you might think, okay, well, we know that X amount of students are mixing these two substances together. And so we're going to choose to do a campaign, a piece of communications around that. And then you look to deliver that. And one of the most important things whenever we think about delivery and kind of operationalizing this data is using that as an opportunity to test what works and what doesn't work. And the great thing about this data is, like Molly's done today, you can track it. So it might be that you choose to focus on a particular thing. So let's go back to polydrug use and say, okay, well, actually, we want to see if we can, through education, reduce the number of students that are telling us that they're mixing cocaine and alcohol. And then when the survey comes back again, or when you collect your own data, you can see if some of these interventions work. And we'd always really encourage you to do that evaluation piece. And then you can kind of keep going around in this circle of finding the data, analysing it, delivering something, and then coming back. And we know that a lot of you will do this already, but it's also just really important, I suppose, to have this space to have a bit of a reminder. It's a lot of information. So I'd really encourage you to pick out a few key bits or a few bits of data that really felt really important to you, or kind of felt really, could cause particular harm, and think about what you might do with that. And one of the kind of most important things, I suppose, is where possible, involve students and young people. So we are so lucky that we have this big data set of student use and perceptions and cultures and behaviours. But when we're thinking about kind of, okay, where do we go from here? Thinking about, well, how can we bring students along with us and how can we make sure that we have that co-creation piece is really, really important. So yeah, it's not only the data that tells us what student needs are and what would feel helpful, but also making sure that we include students in that process as well, I think is really useful to making sure that everything lands as well as it possibly could. So I am going to stop talking so we have some time for questions. But if you have your phone, you can sign up using the QR code. And we will also, I'll pop the thing in the chat box, the link as well. Please do consider signing up. It's a really great data set. And it means that we can keep doing this year on year and sharing this data. And we will also put in the chat box the link to the live survey report, which is officially launched today. That is all from me. Thank you very much for listening. And I'm now going to pass back to Fiona, who is going to head up our Q&A session.
Thank you both. It's so interesting, and for me, data always raises lots of questions as well. So I have got a couple of questions of my own. We have had a couple in the chat, but let me just a reminder. I know when everyone's listening, it's not the time you necessarily think about your questions, but do put any questions that you've got in the chat.